Hello everyone. In this video, I will be sharing another FDA new drug approval update. On November 18, 2025, the US FDA approved an injectable small interfering RNA therapy, Plozasiran, to reduce triglycerides in adults with familial chylomicronemia syndrome. Now, let's dive into this medication in more detail. Plozasiran, brand name Redemplo. This medication was approved by the US FDA on November 18, 2025, and indicated as an adjunct to diet to reduce triglycerides in adults with familial chylomicronemia syndrome, FCS. FCS is a rare genetic disorder with extremely high triglyceride levels of over 880 mg per deciliter. This medication is available as a 25 mg per 0.5 milliliter in a single-dose pre-filled syringe. It's given subcutaneously. Recommended dosage 25 mg subcutaneous injection once every 3 months. Plozasiran is a chemically modified double-stranded small interfering RNA. You can see all this nucleotide motif has been modified. For example, for the nucleotide which highlighted in black with the 2 primer methoxy groups, with one underlined in blue, so which means the 2 primer position have this fluorine atom. So therefore, this is chemically modified. They changed this beta D ribose to this 2 primer methoxy substituted as well as 2 primer fluorine substituted motif. So in addition, this small interfering RNA is covalently linked with the 3-sugar moiety, which is called an acetyl-galactosamine. So this motif. So this 3-sugar moiety will help to interact with the receptors on hepatocytes, facilitate its uptake and delivery in the liver. Mechanistically, this medication works as a apoC-III C3 directed small interfering ribonucleic acid, this siRNA, and binds to apoC-III messenger RNA, causing messenger RNA degradation, decrease hepatic and serum apoC-III protein. So therefore, this would increase the serum triglyceride clearance. As mentioned earlier, so this specifically chemically modified double-stranded siRNA covalently linked with the 3-sugar moiety in acetyl-galactosamine. So all these 3-sugar moiety will bind with the receptors on hepatocytes. So therefore, facilitating its uptake and delivery to hepatocytes and in the liver. Pharmacokinetically, Tmax, that's the time to reach maximal plasma concentration, about 6 hours. Volume of distribution is 146 liters. Basically, this medication will be well distributed in the plasma as well as extracellular fluid before its uptake into hepatocytes. Protein binding 78% based on in vitro studies. Metabolism. This medication is metabolized into smaller nucleotide fragments by this enzyme nucleases. Basically, this would be this enzyme will hydrolyze this siRNA molecule into smaller nucleotide fragments. Half-life is about 3 to 4 hours. Excretion in the urine about 16 to 19% excreted in the urine. Drug-drug interactions. On the basis of in vitro studies, no clinically significant drug-drug interactions are expected. Currently, there are no contraindications listed on the prescribing information. Adverse effects greater than or equal to 10%, hypoglycemia, headache, nausea, injection site reaction. These are the key references which I have used to prepare for today's video. The US FDA New Drug Approval Updates 2025 is a very valuable resource. In addition, most of the medication information which I share today are based on Redemplo prescribing information. This document is available at the US FDA drug website along with the drug manufacturer website as well. Finally, I want to thank you all so much for watching. If you found this video helpful, consider subscribing for future medication video updates. As always, keep learning and elevating. Thank you so much.